Diabetes. It will damage your eyes, and given enough time, it will weaken your vision and cause blindness. So, let's talk about how diabetes affects your eyes, but more important than that, how you and your doctor can defend against it. Hi, I'm Dr. Lawrence Tino. I'm the training officer of Manila Med and of the Emilio Aguinaldo School of Medicine. Diabetes. It's a problem both of the young and the old, the rich and the poor, even those in love and those in pain. So what the hell is diabetes? Diabetes is a chronic metabolic disease characterized by elevated levels of blood sugar or blood glucose. Over time, this will lead to damage in the kidneys, your heart, your blood vessels, your nerves, and your eye. Let's talk about how diabetes affects your eye. Here are 5 ways wherein diabetes can affect your eyes. First, the grades of your eyes. There is myopia, astigmatism, and what we call myopic shift. The change in refraction is associated to the control of blood glucose levels. But the exact mechanism on how it does that is not yet fully understood. Change in the visual acuity could be an indicator of how well you are controlling your blood sugar levels. Or sometimes it could be the first indication of a problem with diabetes. The common pattern in Asia is that the younger diabetics have myopia. Or if your blood sugar level is higher, you tend to have myopia. The second way that diabetes can affect your eyes is through dry eyes. Studies have indicated a 54% prevalence of asymptomatic and symptomatic dry eyes in diabetics. So to put that into perspective, if you gather a room full of diabetics, more than half of them will have dry eyes. As a diabetic, the older you get, the higher your chances of getting dry eyes due to diabetes. As a woman, you will have a 50% higher risk of having dry eyes compared to a man because of diabetes. It seems weird that high blood sugar can lead to dry eyes. However, hyperglycemia causes its damage through the neural pathways that's controlling your entire lacrimal system. This results in low tear production, increased tear loss, changes in the composition of your tears, abnormalities in your blinking system, and all of these combined causes dry eyes. This condition is called diabetes mellitus dry eye syndrome, or DMDES. This leads to poor vision, corneal scarring, corneal ulcers, and secondary bacterial infections. Diabetes and infection are a bad combination. They feed on each other. They make each other worse. These small scratches become worse and worse until eventually they become permanent. Treatment for that is corneal transplant. So, not only is your eye dry, your cornea is also damaged, and this is very common with diabetics. This follows that if you are diabetic, you should be extra vigilant when you're wearing contact lenses. With the latest technology in the manufacture of contact lenses, they are safe to wear even if you are diabetic. But do not cut corners in the cleaning, the wearing, or removal of the contact lenses. Okay, the next 3 complications of diabetes in the eye are the worst. Ignore this and you will surely go blind. Okay, the next is cataracts. A cataract is the clouding of the lens of your eye that should normally be very, very clear. Not only does it become opaque, it also increases in size. Now, if you have diabetes, you are 5 times more likely to get cataracts compared to a normal individual, and you will get it earlier. Also, as a diabetic, once you start getting cataracts, it will mature faster than everybody else's. And most of my patients who are younger than 50 years old who has cataracts actually has diabetes. In diabetics, they have a higher level of sorbitol. And this sorbitol gets trapped inside the lens and it swells the lens fibers. This disrupts the clarity of your lens and eventually destroys or liquefies your lens fibers. Now, the lens is opaque and fat, not the crystal clear lens that you're used to. Eventually, your cataract turns white into something we call hypermature. Other risk factors are hypertension, obesity, too much time in the sun, and smoking. Surgery is the only way to treat cataracts, but usually you don't need to have it done right away. Using brighter lights at home, adjusting the grades of your glasses, or using sunglasses when you're outside usually helps at first. But when it's starting to interfere with your daily activities, probably it's time to have the cataracts removed. The good news is that cataract surgery is done on an outpatient basis, and it's the fastest and safest major surgery done today. And in the end, your vision should be improved. Most people have better vision afterwards. The bad news is diabetes creates a lot of complications, and if you have any of these next two complications, it will make your cataract and its treatment more complicated. The next is glaucoma. Glaucoma is a group of eye diseases that damage the optic nerve. Usually, it's because of too much pressure inside the eye. If you have the habit of consulting Google for everything, you will be told that glaucoma has the following symptoms: eye redness, eye pain, blurring of vision, a very hard eyeball, and colored halos around the eyes. I want to tell you that that information is wrong. Those are the symptoms of severe glaucoma. Early glaucoma does not have any symptoms, none whatsoever. In most types of glaucoma, the symptoms and vision loss happen so slowly that you will not notice it. Statistics say that people with diabetes are twice as likely to develop glaucoma. Other risk factors for glaucoma are family history, increasing age, and your race. As far as race is concerned, you are more prone for open-angle glaucoma if you are black, and you are more prone for closed-angle glaucoma if you are Asian. Diabetes can also cause one of the most difficult types of glaucoma to treat, the dreaded neovascular glaucoma. In neovascular glaucoma, diabetes disrupts the blood flow inside the eye, basically choking everything inside the eye. Your body responds by rushing the production of new blood vessels as fast as possible. However, as most rushed things are, these rushed blood vessels are defective. They leak, contract, and basically creates more problems than they can solve. The ones in the iris eventually block the drainage inside the eye, creating a massive increase in the pressure inside the eye. So the pressure builds up and up and up. Treatment for this type of glaucoma can take an entire team of doctors. If there is one word that I want you to remember about glaucoma, it's the word irreversible. Your optic nerve does not regenerate. So when your optic nerve dies, it's gone for good. We currently do not have a way to prevent glaucoma, but treatment can help control it. We need to catch glaucoma early. See your doctor even if you're feeling okay. Share with us in the comments for any questions that you may have. Have a great day.